This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Are you tired of logging into multiple systems and duplicating your work? Managing your practice's payments can be complex and time-consuming. But it doesn't have to be. With Dr. Chrono, you can have access to our payments feature, which is fully integrated, so you save time and get paid faster, a game changer for medical practices. With Dr. Chrono Payments, you can process more payments, minimize administrative tasks, and streamline your workflows. Streamline the payment process and improve revenue streams in one unified platform. Visit drchrono.com/revenue-cycle-management today to see how Dr. Chrono Payments can transform your practice. Elation Health wants to support all those looking to start their own DPC practice. For that, they created a checklist for how to launch your own practice. Learn everything you need to know about planning to open a new DPC practice, from Medicare opt-out requirements to legal advice, financial support to marketing know-how, and the technology resources available to DPC physicians. With Elation's EHR, ensure your patients receive high-quality, proactive care through an intuitive clinical workflow while reducing manual work and charting time. Elation Health's EHR supports you throughout all stages of your DPC journey. Visit elationhealth.com/mydpcstory to download today. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care is a practice model that has allowed me to take care of my patients, my family, and myself in the ways I've always wanted and felt we deserved. As someone who has struggled with and always felt like a square peg in medicine, I can proudly say that I now practice primary care creatively and sustainably with full authenticity and joy. I'm Dr. Sonia Singh, and this is my DPC story.
Dr. Sonia Singh is an internist, writer, and founder of Juniper Modern Primary Care, a direct primary care practice serving busy women in Houston, Texas. She enjoys helping patients live healthier, happier lives using a proactive and personalized approach that focuses on optimizing nutrition, sleep, mindset, physical activity, and stress management. In addition to her practice, Juniper Modern Primary Care, she helps physicians practice medicine creatively and sustainably with autonomy, authenticity, and joy through virtual education and consulting business Micropractice Mama. Her writing has been featured in the New England Journal of Medicine, Annals of Internal Medicine, and NPR. Thank you so much for tuning in, everybody. Find out more about DPC, including resources, discounts, my favorite tech tools, books, and more at mydpcstory.com. The mapper, again, has been updated, so you can look for practices separated by specialty. Follow us on your social platforms at MyDPCStory, and be sure to subscribe to our newsletter and, of course, the podcast, so you won't miss when the next episode drops. So with that, I'd like to welcome our guest. Welcome to the podcast, Dr. Singh.
Thank you. I'm so excited to be here.
I am also so excited because just doing research about you and your history before this podcast is one thing, but hearing it straight from the mouth of the person who's experienced is another. And one of the things that I just really picked up on is that you're a mom of young kids, you're a DPC doctor, and you're doing all the things like your digital course, and now you have a podcast. So I want to start with going back to something that you had written about after you had practiced for a few years in private practice, and that was about the time in 2019 when the World Health Organization defined the ICD code for burnout as an occupational phenomenon that results from chronic workplace stress that has not been successfully managed. And I think that your article that you wrote for the Annals of Internal Medicine back in 2020, was it? I think it was 2020.
I think it was just before the pandemic, 2020. Mm-hmm.
Yep. Was entitled An Open Letter to a Burned Out Intern. And so I want to go into that because clearly you could not have written such an impactful piece had you not experienced burnout. And I'm sure your definition of burnout is very different than the black and white definition in the ICD-11. So please bring us back into that mindset of who was the person writing to another intern or your former self when you wrote that letter, because I think that you'll have a lot of listeners who are going to relate very much.
Yeah. Even though that piece was published in early 2020, it was truly a letter to myself as an intern, which was maybe more than 5 years prior to that. And like a lot of the things I've written, I think it was something I was writing in my mind for years before I actually put pen to paper, or I guess hands to keyboard in this case. So it really, truly was a personal letter. I was in a writing class and the prompt was write a letter to your former self. And so that was the version of myself that I wanted to say something to. And that's how it came to be. I was somebody that I think always kind of felt like a misfit. I think of myself as a creative at heart. I actually hate hospitals. I've always hated hospitals. I still hate hospitals and I don't ever set foot in them really. And so there were a lot of times going through education and training where I found myself doubting, is this where I'm meant to be? And particularly when I got to residency, and I don't think I was at a particularly toxic program. I actually think it was a pretty good supportive program. And I don't think my training was even the hardest. I mean, I wasn't a surgical resident. I think it was a pretty standard residency experience. But being somebody who is highly sensitive, emotional, slow, needs time to process, needs time to reflect, needs sleep, I just did not find that environment brought out the best in me. And I wrote the letter because I felt like the message I got a lot was that this was a me problem, that this was something wrong with me, and that I needed to fix my own internal problems. And it was my fault that I was feeling this way. And that phrasing of chronic workplace stress that's not successfully managed, I think perpetuates this idea that it's on us to manage and we're failing to manage. And that's why we're burnt out. But the reality is, it is an occupational hazard. It's a direct consequence of the training environment, the hours we work, the stress we are under, the intensity of the entire experience. And the message I wanted to send people who were in that position, like myself, was this is temporary. This too will end. It gets better. And all of these things that are making this experience really hard for you are actually going to be strengths when you're out in the world and you're a physician. And not only is there a place for you in medicine, but you belong in medicine. And we need doctors like you that are as sensitive and committed and emotionally invested in everything. And so that was really what prompted me to write that. And I do think that having some of those qualities were the same reasons that I eventually got to DPC, because I do believe it's an environment that supports my sensitivity and supports my well-being. And in a lot of ways, my DPC journey is my own wellness journey.
And I think about what the messages are delivered by every single physician, including yourself now, who have shared on this podcast, that continuously comes out, that this DPC model allows me to celebrate me and to function as me and to continue and thrive as me in the future. So I want to ask there because, again, I'm sure that there are people who are nodding, if not in tears, because your words are speaking to them, even without reading the letter that you wrote. And just as a point of fact here, go to mydpcstory.com. You'll find Dr. Singh's episode, but also her blog accompanying this podcast with the link to her Annals of Internal Medicine letter. Can you give us a few examples about experiences that you went through that you thought were totally normal until you realized they weren't? What are some experiences you had in your medical journey that prompted you to say those specific things?
Well, I think when I was deep in it, it was really hard to see that. Like you can't see the forest from the tree. You know, like it's water. It's what you're living in. And so you don't realize how abnormal it is that you have one day off a week and that during that day, all you can get done is your laundry and your grocery shopping and making some meals for the week. Like that's not a normal way to live, but we consider that very normal. It's not normal to walk in and tell somebody, do a death exam and pronounce somebody dead, and then to go to noon conference and eat salad and a muffin and listen to a talk. Like it just, they become normal because we do them. And I think we learn to compartmentalize and dissociate. And I think some people are really good at that and some people are terrible at that. And I am terrible. So I found that just the rapid pace of residency, the schedule, the things that I was seeing, it's this front row seat to the human condition. And it's not typical. Like so many people live their whole lives and are never in a room with somebody who's actively dying. And yet we do that a lot in residency. And it's so funny how the experience I had in residency, which was such a stark contrast to the experiences that led me to medical school in the first place. I mentioned this to you before we started recording, which is that the experience that I think really made me think I want to do medicine, it is for me, is this experience I had in a rural clinic in Oaxaca. And I was shadowing a doctor who was by herself in a room with a typewriter and an exam table and a stethoscope. And patients would come in and she would take their history and do an exam, and she would write a little prescription and type up their note. And then the next person would come in and she would do the same thing. And it was so simple. And something about that experience, like just the intimacy of one patient, one doctor, not a lot of other stuff, like one typewriter, a piece of paper. I found it so elegant and beautiful and just thought, I can do this. I want to do this. This seems like a great job. And when I got to training and even practice after training, it felt nothing like that. It just felt so frustrating and fragmented and stressful. And that whole patient-doctor dynamic that should be the heart of medicine just didn't feel like it was the heart of medicine anymore. And I think it was just a combination of experiences and the stark contrast that had with what I wanted and envisioned when I went to medical school. And I don't think I appreciated how strange and unusual that was until I was out of residency and had some perspective on it.
And here, this leads me to my next question perfectly. There are so many people who are open to knowing about DPC and embracing the facts about it, that literally you can make an income, you can be sustainable, your patients can get amazing access no matter what their income level is in DPC. So I want to ask here, for those people who are really intently listening right now, what would you say to those people, whether they're in residency or whether they're 15 years into medicine, as a, you know what, here would be a great idea for a check-in to see if you are happy in your current career or if you should be open and continue to look down into the DPC rabbit hole?
I mean, I think the biggest question to ask yourself is, do you feel good about the work that you do? Are you proud of the work that you do and the way that you do it? And does it align with your values and what you believe in? And I think for so many of us in DPC, like we feel like kindred spirits because so many of the things we believe are the same, which is that patients deserve better, doctors deserve better. We should, again, reprioritize that doctor-patient relationship. Physicians should have autonomy in their schedules in the way that they take care of people. And I think if you're feeling that you are not in a place that, or not doing your work in a way that aligns with your priorities and values, you should consider an alternative path. And DPC is a great one.
And it is so refreshing. And I think that that's why I love doing this podcast and people like yourself listen to this podcast, is that you are a great example of doctors who are choosing to not only ask themselves that question, but to act on, yes, this is not the right job for me. I need to find something else. So on that note, when you had seen this doctor in Oaxaca, you had gotten that seed planted in your head about, oh my gosh, this is really simple and accessible for patients, sustainable for doctors. What happened that led you into making the switch, even mentally, to say, I'm not going to do fee-for-service any longer?
Yeah, it was kind of a long journey to get there, honestly, because I never would have envisioned, if you asked me 10 years ago that I would be doing this, I would never believe that I would have done this. But I finished residency. I took a primary care job with my home institution and honestly was very happy. And I was happy for several years doing normal, traditional fee-for-service practice. I, of course, had my normal gripes that we all have, but I didn't let those bother me too much. And I loved my job. I loved my patients. I was happy to be there. Really, the change for me, the turning point was 2020, which was both the pandemic and motherhood. And so it was a perfect storm of a lot of different things happening at the same time. I'm married to a palm critical care doctor. So 2020 was an incredibly stressful and hard year for him also. And so I think for me, coming back to work after maternity leave in the height of the pandemic, pre-vaccine, with a husband who was doing what he was doing, I just had this new lens on life and work and everything that I was doing. And motherhood really forced me to start scrutinizing how I was spending my time. So when I was single or married without kids, I didn't really mind having to be at work until 6 or 6:30 sometimes, writing my notes, finishing my charts. It didn't bother me that much, but suddenly every one of those minutes felt like it was a minute I was like taking away from my child. And then at the same time, as a patient in the system, I found myself struggling to get in with my own pediatrician, struggling to get in with my own OB, struggling to make my own follow-up appointments, and feeling like, gosh, you just get kicked out into the world with this new baby and this whole new life. And 6 weeks later, someone says, hey, how are you doing? And like, that's all the support we get. So as both a patient and a doctor, I was finding myself viewing everything very differently. And I started doing this tossing and turning at night of like, how am I going to stay in this career? How am I ever going to grow my family more? How am I going to do this for 30 or 40 more years? And I came across DPC during that time, like in Facebook groups. If you are in primary care and you've said, hey, I'm unhappy, what should I do? There's always a few people that come out of the woodwork and say, do DPC, because we all want to shout it from the rooftops. But at the time, that didn't feel accessible to me. I looked at the people who were kind of like pioneers of DPC, and it felt like they didn't look like me. I was just a brand new, fresh mother. I had no business experience. I had honestly no interest in business. I didn't have these big, lofty goals of starting some huge network of clinics or any, like I literally just wanted to find a way to do my job in a way that felt good and sustainable and allowed me to be a mother. And so initially I wrote it off as something that I wasn't for me. And I hear that so much from other women who will say, oh, I'm really unhappy in my job and I'm looking for another way to do primary care. Don't tell me to do DPC. And like when you say, why do you say that? They just assume that it's too hard. It's too much work. They're not in the right season of their life to do it. And so those were the thoughts that I had initially. And honestly, it was really joining the Facebook groups with DPC doctors, listening to your podcast, this podcast that we're doing right now, and then meeting or speaking one-on-one with other DPC doctors. And once I heard individual stories and could see that a lot of people were having my experience, and you have that feeling where you're like, oh, I found my people. Like these people are all saying the same things I'm saying and feeling, and they're doing this thing. So once I had the model in front of me of a few people who had done it, it made me braver and made me think, no, not only can I do this, but like I have to do this because there's no other way to make this work.
Absolutely. I think that it's interesting because I think about when I was getting into DPC in terms of starting the business, I consumed so many, especially in my world podcasts. How I built this is one of the entrepreneurial podcasts that I absolutely love. And I relate this podcast to that in terms of this is the individual stories that make entrepreneurship for a person with an MD or DO less magical unicorn, can't ever do that sort of thing, right? So it's wonderful. Yeah. So it's wonderful to hear that, because I also think that there are so many opportunities for people to learn that if you want to start a DPC, fantastic. If you want to join on into DPC, fantastic. If you want to do telemedicine only, fantastic. Like I have said this before, I know you've heard this, but if you've seen one DPC, you've seen one DPC. Yeah. And that is because the model allows us the autonomy to practice sound medicine, but with the time that we need to do it. And so I love that your barriers were further broken down because of hearing other people talk and even seeing other people's clinics. Because you were in Houston, you're in a super hotbed. Yeah. I was talking to another doctor about this recently. If there's another DPC by you or within driving distance, put something on the calendar, make a date with that DPC doctor and go check them out, because it is definitely a different thing to see a DPC doctor in person, and to see their clinic is another layer of, it's like an extra layer of icing on the cake. So I want to ask now about going from the mental transition of that's not for me, and then to, oh my gosh, I could actually do this, to then developing your model. How did you decide that you were going to be a micropractice mama? How did you decide that that was the model that was going to work for you out of the gate?
Yeah, I think when I first started, I honestly didn't know exactly what I was doing. And so this was all a winding road that brought me here. When I first started, I kind of just was like, it's going to be a clinic for everyone, and I'm just going to do good medicine. And I didn't really have a clear vision. And very early on, I had hired a brand designer to help me with my logo and my colors and full brand design. So really not just a logo and colors, so much more. And when she got me on board, she had me do a bunch of questionnaires, really honing my business vision and saying, who do I serve? Who do I want to serve? What are that person's pain points? How do I want to serve them better than others? Like really drilling down and forcing me to think about those things. And it was really in that process that I started to think the person I want to serve is moms, like moms 20s to 50s who are kind of being left behind because they're taking care of everyone else's needs before them. and they're seeing their OB once a year, and maybe they don't have actually a dedicated PCP. And a lot of those women were showing up in my office in their 50s with all kinds of issues and saying, why did nobody tell me this when I was 35? I realized, especially in that moment in my life when I was a new mom and feeling unsupported, I thought, that's who I really want to serve. And it was in that process that I made the leap of just saying, you know what? I'm going to have a practice for busy women, for moms and busy women who are kind of 20s to 50s and feel like they're not getting the care that they want from a traditional PCP office. And so once I made that decision, I actually felt like so many other decisions about the practice were so easy to make because I had that person in my mind. And so when I thought about what kind of office would that person like, and what kind of messaging do I want to have on Instagram, and what is my website going to look like? All of those things were easier once I had that vision of who I wanted to serve. And in terms of the micropractice model, I think for me, as you said, you've seen one DPC, you've seen one DPC. So it's so beautiful that we can make the model serve our strengths and weaknesses. And so I particularly was stressed about the idea of hiring and firing staff. And I am also one of those A-type personalities that like double and triple checks things. And I need to work on delegating. But for me, I was not excited about the idea of introducing staff members and having to manage that. That was one of the things that I didn't like about the idea of running a business. And so I'm also an efficiency junkie. And when I thought about starting up, I thought I can automate so many of these things. I don't know if I need a person. So I started with the idea that right now I'm so low volume and I don't need anybody. If I get to the point where I feel overburdened or I'm stretched thin, like I will add someone. Right now, I'm 150 patients in. I make what I want to make. I like the amount of work that I'm doing, and I don't feel like I need a staff member. So I found that for me, micropractice is great. And I think that's partially because of my preferences and also the fact that I'm so low volume that it works out. I think micropractice to me is a way that people who are not necessarily excited to run a small business can still do it and have that full autonomy and control without having to do some of the people management.
Absolutely. And when I think about those words in particular, I think about the people on Facebook who are asking, oh, but I wish I could do it as a telemedicine model, or I wish I could do it as a telemedicine model to start until I found a space. And there's a lot of options because the options in DPC are infinite. So definitely going back to what you said about like finding who you are going to serve to help be the foundation of everything that you built. Part of that foundation can be, how do I want to practice? Do I love being able to travel? Do I love being able to just go to whatever school performance they drop on you 2 days before it happens? If your lifestyle is pushing you towards a particular way of practicing, look for other doctors who are doing something like it or who are doing that exact model. So when you were then in this mindset of, hey, then I'm growing, I can automate and be efficient at things, how did you reevaluate your day-to-day so that you could hone in on, oh, I could actually automate this, or I could be more efficient if I did it this way?
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
Yeah. So I was thinking about it from the very beginning. I have always been, like I said, an efficiency junkie and thinking about what's the fastest way that I can have my coffee done and ready to go by this So to me, like getting to build a system from scratch felt like I was like a kid in a candy store. Like I was very excited to choose all my tech and figure out how it would work together. So when I was choosing my platforms, like integration was really high on my list of priorities. Are these systems going to talk such that I'm not taking one file out of here and putting it in another place myself? So that was my first priority. And second priority was usually like user experience for both me and the patient. Does this work with the way that I think and the way that I usually do my practice? I basically chose tech that integrated really well. I rely heavily on like automation, smart phrases, auto replies, and it's worked out for me actually really well. And the other beauty of doing it this way and having kind of like that integrated tech is I'm paperless. So there's just no paper in my office at all. When patients bring it to me, I'm like, I'll take a picture of this and upload it. Like, you can have it back. So there's no paper, there's no shredder. It's like a very lean, simple operation.
I love it. I'm laughing because I'm like, the exam paper, and if you're watching the YouTube, is like the paper in her office. Like that is awesome.
Yeah, that's
like...
true. That's the only paper. and I hate changing that paper. You have to really get down there and change it. I'm like, this is when I miss my medical assistant. I have to change the paper.
I would say the pros definitely outweigh the cons in that sense, but I love that. And in terms of thinking about, again, like the user experience, it's very much rooted in who are you serving? You're serving people who are like, I am sick and managing 3 children at home and I have to do carpool. So if you want to make this hard for me, I'm not going to join your practice. So it really does drive how your clinic is built. With that, you also have a space, a beautiful space. Again, if you're watching the YouTube, you can see the beautiful space. Tell us about how you found your space and how you made it yours.
Yeah. So when I first started, I actually just started renting a room. And so I started really, really small. Like literally all I had was my tote bag and a laptop. And then I showed up and it looked like I had been there all day, but I was really just showing up when I had patients. So I was able to kind of save up enough after the first year to get a lease on a space. And then I did some pretty big renovations of that space to make it my own. It's small, which I think is another thing that people are so intimidated by rent and getting a space. And they have these ideas about what a doctor's office should look like. But again, in direct care, you make the rules. And I think once you have moved your brain out of the paradigm of traditional care, you start realizing there's so many possibilities of everything, including what your space can look like. So my space is it's probably a little less than 600 square feet. And there's like a waiting room that really looks like a living room. And that's where actually I spend most of my time with patients because that's where I take the history. And then I only bring them into the exam room to do the actual exam. And I don't have an assistant. So I do their vitals, which I think honestly makes them feel like I'm doing an even more thorough exam. And then I examine them and check them out myself. And then I have another little room that is sort of my office/consultation room. But my vision for the office was to make it feel like your friend's chic apartment that you were just going to. And what I had in my mind was, I know the feeling that I get when I walk into an anthropology. And I was like, I want people to get that feeling when they walk into this office. Like you get hit with this nice soothing smell and there's all kinds of beautiful things around and someone welcomes you. And so I really try to achieve that in my medical space. And so I have a glass door so people can see in from the hallway. And so many people pop their head in and they're like, what is this place? And I say, it's a doctor's office. And even though it says primary care, I think people just have a hard time wrapping their head around the fact that it's a doctor's office. So I've tried to make it really warm and welcoming. And because, again, it's such a low volume practice, you don't have to have the industrial furniture. And it's okay to put a rug down and to make it feel a little bit more homey.
And I know I've mentioned this, but I will say that like nice things are at Target and nice things are on Wayfair. And so if you have your Black Friday list ready to go when Black Friday month happens, you can get your things that you want and you can also save while you're doing it because this is a couple months before Black Friday, but definitely time to prepare, especially for those who are planning to open. So
yeah, the majority of my office stuff is actually Wayfair Professional, so it's not expensive. And then all of the art, I feel very passionate about this, all of the art that's in my office is by local female Houston artists. So everything I've chosen to put up, I've like really thought a lot about. And I think a lot of people kind of balk at like making stuff, you're just making it pretty. Like patients don't come because it's pretty. That's totally true. But I think when every decision you've made about the experience you're providing is thoughtful, they feel that. They walk into the room and they feel that energy. And that's important to me.
I absolutely love that. I literally came from right before we had our talk start, a patient who had gone to the dental office that we purchased for years, like she knew what it looked like before. And because of what you're exactly talking about, the thoughtfulness that we have put into the clinic, that you have put into your clinic, patients, people who are not patients, like peeking in, they get that this is different. So I think that also inspires people to then ask, like, so what is this, right? So your efforts are going to be fruitful in the end of the day, is why I say that. So when it came to not only having a space, the materials that you have within the space to practice care, can you give us a breakdown of what did you need to start with? And has that changed much now that you're over a year into your practice?
Yeah, I mean, honestly, it hasn't changed a whole lot. Once I moved up, the rented space I was using was already a furnished room, so it had most basic supplies. And I would bring my Smart Heart EKG machine, and I would carry around all my rapid point of care tests with me. And honestly, that's pretty much what I still have. I bought my own scale. I bought my own refurbished exam table, which was a bargain. And thankfully, I live in Houston where there's a ton of used medical supplies available. And then in terms of other medical equipment, it's really, like I said, I still have the Smart Heart. I have a thermometer. I have a blood pressure monitor. I have my stethoscope. I have tongue depressors. I have my point of care tests. And honestly, I think that's pretty much it. I'm an internist, I should say. So I don't do gynecologic exams and I don't do procedures in the office, which cuts down on a lot of the stuff that I need. And for those things, I just maintain really close relationships with OBGYNs and general surgeons and dermatologists and people that I can send those people to if they do need that care. Yeah, I'm actually, even in terms of stuff, I don't have a ton of it. I always joke that I strive for minimalism in so many aspects of my life. I wish I had a minimalistic home. I wish I had a capsule wardrobe. I can't achieve any of those things. My home is filled to the brim with toys and Hot Wheels. I have all kinds of crazy clothes. But in medicine, I have managed to achieve minimalism with the practice model, with my office. It is definitely kind of stripped down to the basics.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited, customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
I love it. I love it. Now, how about distance from your home? How far is your current practice space from your home?
It's around 6 minutes. It's one exit down the freeway, which is honestly the most amazing thing. All my patients know that I just pop in and out. Sometimes they beat me there because I'm like just coming back from home. I have a 7-month-old. I just weaned, but before that, I was going home to nurse at lunch and, was able to kind of maintain that for a really long time. So I just think for quality of life and compatibility with motherhood, that having those things be geographically close was a big priority, and it's been wonderful.
And so definitely, if you are a person who is thinking about starting DPC or about to sign a contract and you'd like to do DPC in the future, definitely think about your non-competes. Like, they are up in the air as to when will this non-compete business be put to bed forever. But ask other DPC doctors if non-competes are even enforceable in your state. But definitely what Dr. Singh is talking about is so important because it adds to one less thing in your day, one less mile of traffic that you have to get through, or one less mile of snow that you have to drive through, whatever it is in your region. Definitely think about, where do I ideally want to practice? And if you're about to sign a contract of any sort, look for verbiage that could affect that. So on that note, I want to ask about your pricing, because clearly you had your ideal patient in mind, your ideal group of patients as you grew the practice. How did you approach pricing at your DPC?
Yeah, I mean, I'm glad you're asking me this question and we're talking about it, because I feel like this was a very controversial decision when I started. And now I feel like more and more people are starting to maybe have my approach to this, which is I initially just started looking around at other services and how much other similar services cost. And for instance, there's health coaches in my area that charge $300 an hour. There's personal trainers that charge that much. If you go see a psychiatrist, I mean, that's often $300, $350 an hour here. If you see a licensed therapist, that's going to be $150 or $200 an hour. So I thought about sort of what my time was worth per hour. And I thought about how many hours I was likely to see each patient. And for me, I think my practice model is a little bit different. I am, I think, a little bit more of a concierge style DPC. Like I said, everything is automated for me. My patients sign a records release. They do all their forms beforehand online. And so I typically spend 30 minutes reviewing those things before they've even come for their appointment. The first appointment is often an hour, sometimes an hour and a half for patients who are medically complex. And then after that, I often spend 45-ish minutes writing up like a comprehensive summary, sort of a health assessment with action items and recommendations and things that we're going to work towards. And then pretty much everyone gets some labs. And then once the labs are back, usually within a couple of weeks, I'm doing a follow-up appointment with them and going over those. And so if you add that all up, I mean, that's like easily 3 to 4 hours in the first month that I'm spending with that patient. And so even if they disappear and they don't come back again for 6 more months, I wanted to feel like I was being fairly compensated for that time. And so I was leaning towards pricing more somewhere around 100 to 150 per month. That was like what the number that felt good to me at that time. And then I also did the reverse engineering trick of thinking, how many patients do I want to take care of? How much do I want to earn? And estimating my overhead and then figuring out how much do I have to charge each patient in order to get to that number. I think the hardest part of using that model is knowing how many patients you want to take care of, because this model is so different from fee-for-service. Like when I switched from fee-for-service, I thought like 400 sounded like a dream come true. I was like, I can take care of 400 in my sleep. Like that sounds so easy. And then once you open, you have to see, how much time you're actually spending with people and what kind of population you're attracting and what their needs are. And so I started with an average price of $150 per month per patient. And after the first year, when I signed the lease and moved into my own space, I moved to an average price of $200 per month per patient. And I justified it in saying, look, we're upgrading our space. We got a new home here. We've got like a nice private office for you. It's more comfortable. It's got more amenities. There's an espresso machine. We're now raising our prices. And I actually didn't raise it on any of the existing patients. I only raised it for new patients. And so my initial crew of people that came with me that first year is still on the original pricing. And honestly, I will honor that as long as I possibly can financially, because I love those people. I feel like they took a chance on something new and they kind of have been my biggest cheerleaders. I kept them at the same price and I raised the price for a new patient. So that's kind of how I arrived at the number that I'm at today.
I love it. And because you mentioned you're at 150 patients since you opened, while being all of the other things that you are. When you look at your initial goal of who you're going to serve, who makes up your patient population at your DPC?
Yeah. So right now it's about 70% women and 30% men. So even though I market myself fully as a physician for busy women, I still get a lot of other people coming along. A lot of husbands will join after their wife has joined and they see how easy it is. I had that fear, and I think other people have that fear when they choose a niche that they're going to miss the variety and lose the variety, but you'll find that you'll still have variety. It's about 70-30 in terms of that mix. About 20% of my patients are uninsured. I'm in Texas, so not everybody has insurance. And a lot of those uninsured people are people who are like between jobs, or they're small business owners themselves and they just can't afford it, or they're gig workers, or in the beauty industry or restaurant industry, or like they're doing some job where they're not being offered insurance and marketplace plans feel very expensive to them. That's the population there. In terms of what they're like medically, I would say I have a portion that are very medically complex, like truly need an internist with more time and more bandwidth to handle their situation. And then I have a chunk that I would say struggle with health anxiety and have insight usually into that. And so they are people who just want a little bit more time and attention from their doctor. And one of the best, I think, most therapeutic things for somebody with health anxiety is to have a trusting relationship with a PCP and to have access to them when they need it. That's another chunk of my population. And then I have a chunk of people that are just very proactive and they value their time. They're busy and they want to have access when they do need me. And so I don't hear from them for a long time. They come in for their physical, maybe 1 or 2 UTIs or sinus infections here and there. But for the most part, I don't see them that much. So it's kind of a broad mix of those people.
Awesome. And so when you mentioned earlier that you hired a brand and marketing strategist to help you, not only as the time came to market to patients, but also just to get you honed in on what you wanted to deliver through your marketing and branding. Tell us about that process of hiring someone to help you?
Yeah. I mean, I would say whenever I've hired any vendor to do anything, I have tried to choose somebody local and I have tried to support a small woman-owned business. So I looked around at people who were doing brand design in Houston and I found somebody whose designs I liked and spoke to me. And like I said, I don't think I really appreciated how much she was actually going to help me. I just thought, okay, she does good work. She's going to be a great fit. And she also fell into my demographic of being a woman in that age range with small children. And it's funny because I came to her with an idea of what I wanted the logo to look like. And she gave me like a first iteration that was just kind of like, am I on the right track? And as soon as I saw that, it was exactly what I was asking her for. But I realized after she had made me do some of that mental work, that thought work of who is this person and who am I trying to serve, that logo was actually completely wrong for me. It was a nice logo, but I just realized that the logo that I was initially envisioning was kind of like young and hip. And it was like what I was seeing with a lot of like tech startups, that they were kind of having these bubbly letters and lots of colors, and it was fun and whimsical. And when I saw it, I just realized, I don't know if this is my patient. I think my patient is a little older, is a little more mature, probably wants to see something a little bit more sophisticated, a little bit more elevated, feels more like a luxury experience, kind of has that anthropology vibe. And once I had done that thought work, I realized that my first thought was wrong and it was just not the right fit. And so I told her, I was like, I hate that you already did this, but like, I think we got to move in a different direction. And she was like, I think you're right. And so then the second iteration of the logo is what ended up becoming the logo and what you see now on my website.
Awesome. And I think it's so invaluable for people to hear that because, again, it goes back to, it is ingrained in us to, this is the instruction, you will follow it, you will be here on your shift time, et cetera. And when you hire a vendor, remember you're the one who's paying the bills. So if it's not working for you, you can say something. You will survive after it. Sometimes it takes me aback remembering those things, even years into DPC, but it is so true. So tell us about how you then used your logo and your brand to start reaching out to people.
Yeah, I think that basically it's what I said before about really having a clear, like razor sharp vision of who is the person that I'm serving and thinking of that person every time I was making a decision. So when it was like, what am I going to post on Instagram? What am I going to talk about? I, again, tried to envision that person. And honestly, there were a few actual people that I could envision that I could think about, like patients that I had in my old practice that I was like, those are the people who are needing something more from primary care. And what are those people struggling with? And sometimes it was things those people had actually asked me that I would think, okay, that's a great post. And I think that what you see of the branding, like the visuals, the logo, the colors, the fonts, they're all saying a lot of things to potential patients or the viewers non-verbally, just from the way that they look together. And it's really just a matter of continuing to be strategic and thoughtful about each of the things you're adding, your voice, the content you're sharing on social media, the way you write on your website. All of it should feel like it speaks to that person and is also authentic to you. So that's what I just have tried to do consistently in both my website and my social media and now my podcast.
Amazing. So tell us about that. You have not only your podcast and your website and your practice, but you also have your course. So tell us about your course and your podcast.
Yeah. When I was on my maternity leave most recently, I had a second baby in DPC Micropractice 7 months ago. I was on my maternity leave and I was finding myself getting these messages from other doctors saying, hey, can you tell me how you started? Can you give me a few tips? Asking me questions about micropractice, how my practice was set up. And I'd been getting these messages for months. But when I was on my maternity leave, I was thinking like, I should make maybe a document. Like now that I have time, maybe I'll make a document and that way I can send that out when people come and ask me questions and it'll include all the things that I think they should know. And I started writing it and it became way too long. And then I thought, this is a course. Like this is something that I think people, this information is stuff that people should have. And a document is not the right format and it will totally overwhelm people. And so maybe I should make this a course. And truthfully, this is a terrible time for me to be taking on more things. I have a busy practice that continues to grow. I have a 4-year-old and now I have a 7-month-old. But to be honest, the thing that's driving me is just that there's so much hunger. I see hunger for this information. And it's so inefficient for me to try to give it one-on-one or for me to try to give it in a Zoom or an Instagram message or an email or whatever. Again, the efficiency part of me is like, you just have to do this. And then the other part of me feels like we talked about earlier. I just see so many women in my chapter of life feeling like this is not possible for them and it's not accessible for them. And they're like, I'm too overwhelmed to go to a conference. And so I wanted to make it as easy as possible. Like, I will hold your hand. We will make this DPC together. And so that was kind of the mission of the course and the entire Micropractice Mama platform. And so the podcast is meant to accompany that. And basically weekly, I'm just sharing things about my journey, things that I learned, different mindset tips, which I think is like a really big part of entrepreneurship that is under recognized. Yeah, I'm basically sharing all that stuff there.
I definitely would agree. It is so needed. Again, going back to what you spoke about, you saw the modeling of other people doing care differently. And so it is so important to not only see that, but also to have ways to continuously work through how could I achieve doing healthcare differently. So that is a wrap for today's episode. We'll be talking more with Dr. Singh about her experience in being a DPC mom, having a little one during DPC, and also being in a 2-physician household. So join us for that conversation on our Patreon private community podcast. Thank you so much, Dr. Singh, for sharing your journey today.
Thank you, Marielle.
Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community. Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC news on the daily at dpcnews.com. Until next week, this is Marielle Concepcion.